Well, the Academic Health Science Network is part of the European Connected Healthcare Alliance for Mobile Health, and the objective today was to bring together small and large businesses, universities, healthcare institutions and councils to look at how we work together to make sure that e-health solutions deliver what we need them to deliver for patients.
It allows people to come together to collaborate so that they can together find solutions to what are very substantial problems that no individual organisation or sector can solve itself.
I decided to do my presentation around the difficulties of getting joined up care, and I called it Joining the Dots for that reason. And so I discussed at some length what journeys look like at the moment, and I used specific examples of my own and my family's care in order to illustrate where the gaps are and where the mistakes are made and where the difficulties are. And the aim is to kind of inform the day that this is the kind of thing that you need to be looking at and hoping to plug those gaps.
The Red Book is a personal health record to let mums look after the information around their child. And we've been basically sharing the work we've been doing with Liverpool Community Health, and specifically locally. And we're basically trying to scale up that work now and bring on board more partners. We've been having good conversations with people like Declan from Lancashire.
How digital technology can be used to empower citizens to manage aspects of their health and well-being, to enable them to live independently and well, or to manage their condition if they have one. And it's all about, and the third element of that would be about sharing information, making sure that we get the right information to the right person at the right time.
I'm very concerned that we say all the time that we provide less good care at the point of transition. And so a governance framework, a technical architecture and a culture shift that helps us to transfer information properly owned with patient consent across these boundaries and these transitions, so that actually care is far more seamless, and that's care in its broadest sense, both health and social care.
Today we had the advantage of being able to talk about technology that's being built as we speak. We've already gone through a series of hackathons where third-party, particularly SMEs, have come and actually got to try before they buy, if you see what I mean. And most importantly, to touch on the vision for how we would see that citizen health record being portable between different ecosystems and different areas of the country or even the world by virtue of machine-to-machine interoperability. And of course, interoperability of health ecosystems is really what we're here to talk about today.
Because we're part of the European Connected Healthcare Alliance, we collect good practice, we learn from things that haven't particularly worked, we learn from other areas of Europe and beyond because they reach into China and to the USA, and we look at how we can apply that learning into our system. So we know that we're quite a big region in England, but actually we're a small region in the world, so we want to bring learning in from other parts of the world so that we can accelerate our learning and our rollout of integrated health systems across the northwest coast.
It allows them to see us outside of the patient box as real people trying to live real lives. I like to try and emphasise all the time quality of care initiatives and why that's important to us. We can't always get fixed, but what we can always hope for is a better quality of life.
Realise that if health and social care is to be sustainable, it needs to be integrated, and that we need to collaborate and work together much more, and that we co-design everything, and that we genuinely put people at the centre of services and involve them in co-design, and that the ecosystem becomes a vibrant meeting place where all of these particular organisations can meet, can talk to each other, where relationships are established, where it's a collaboration of the willing, and together we realise that we can tackle many of the problems that we face today.
I think 5 years down the line, we want to have joined up solutions across health and social care for our residents. So you don't have to tell your story 10 times to a different professional. It's all there on a personal health record, personal health and social care record for them to have a look at, so they know exactly what conditions you've got, what special needs you've got, and they can deal with you as a whole person, not just as someone they see as a condition coming into a health or social care setting.